All right. Well, good afternoon. My name is Justin Schmitz. I represent the City of Lone Tree and am the Vice Chair of the DRCOG Transportation Advisory Committee. I call to order the March 24th, 2025 DRCOG TAC meeting right on time at 1:30. In this in-person live stream meeting format, members of the public attending by Zoom have the ability to mute or unmute themselves and share their webcam. For those attending online, please make sure your typed name reflects your first and last name and who you represent. We ask that those attending to speak to use the raise hand button to ask a question or comment on an agenda item. If you have any technical questions, you may direct those to staff in the chat box. As a reminder to members and alternates here in person, please press the unmute button on the bottom of your mic stand. Make sure the light on the microphone is on when you're prepared to speak, and speak directly into the microphone so that your voice will amplify. Please announce your name and representation when asking a question or making a comment for the record. I forget that. We all do sometimes. Remember, announce your name and who you are when you make comment. During the business agenda, TAC members and alternates can speak or ask questions. Members of the public may speak during public comment. DRCOG is sending around a sign-up sheet. Please sign in. And at this time, we will go around the room and TAC members and alternates will introduce themselves in person. And we'll start over here with Jordan.
Good afternoon. My name is Jordan Rudel with CDOT Region 1.
Jim Houston with CDOT Region 4.
Justin Begley, City County of Denver.
David Krutzinger, City and County of Denver.
Amy Saxton, non-metropolitan organization seat.
I'm Rice, Town of Castle Rock, Douglas County.
Larry Nemo, Douglas County, City of Castle Pines.
Alex Hydrate, Boulder County.
Michelle Molinakis, Boulder County.
Carolyn Clam, DRCOG staff.
Hillary Simmons, A Little Help, Older Adult Special Interest.
Chris Quinn with RTD.
Carson Priest, TDM Special Interest seat.
Maria DeAndre, Jefferson County, City of Wheat Ridge.
Victor Rochelle, Arapahoe County, City of Inglewood.
Angie Rivera, Malpieti, Equity Special Interest seat.
Good afternoon, all. Matt Callison, Arapahoe County, City of Aurora.
Mike Whitaker, Jeffco, and City of Lakewood.
Brian Weimer, Arapahoe County.
Kent Mormon, Adams County, City of Thornton.
Jeff Dankebring, Arapahoe County, City of Centennial.
Chris Chauvin, City of Westminster, Adams County.
Jeff Boyd, Housing Special Interest.
Brent Soderlin, Arapahoe County, Littleton.
Mike Vanetta, Jefferson County, alternate.
Hi, Frank Bruno, via Mobility Services. Cam Kennedy, DRCOG staff.
Justin Schmitz, City of Lone Tree, Douglas County.
Jacob Rieger, DRCOG staff.
Don Papsdorf, DRCOG.
Dean Sampson, City of Boulder.
I think we got everybody there. I'm now going to pass it over to Jacob for a few announcements on new members.
Yes, thank you, Chair Schmitz. One new member to announce this month. The Southwest Well Transportation Forum elected a new primary member for representing Southwest Weld. Helen Mitchell Brink, I hope I'm pronouncing her last name correctly. Helen, I don't think you're here today, but pleased to have you as the new member for Southwest Weld, and then Evan Pinkham will remain as the alternate for Southwest Weld. Thank you.
Thank you, Jacob. We'll now move into our public comment. We will now open the public meeting for public comment. Public comment is limited to 3 minutes. If you have joined by Zoom, please raise your hand by pressing the raise hand button, and we will call on you to begin speaking. If you joined by phone, please raise your virtual hand by pressing *9. We will call on you by the last 3 digits of your phone number, and then staff will unmute you, and then you will need to unmute yourself by pressing *6 on your phone. You will have 3 minutes to speak, after which time we'll ask you to wrap up, and your line will be muted. As a quick reminder, after the public comment period, only TAC members and alternates will partake in the discussion regarding each item. Do you have any public comment in the room or online? All right, well, with that, we will go ahead and close public comment for the meeting today. And yes, Jacob.
Thank you, Chair Schmitz. I did mean to do one more announcement. We do have a new staff member at DRCOG that I wanted to introduce. For the first time, we have 2 senior safety planners helping us work on safety and regional vision 0. So our second and brand new senior safety planner is Catherine Rush, who just joined us. Catherine, you've been here just a few days, but comes to us from the city of Dallas, and we are so pleased to have her.
Thank you, Jacob, very much, and welcome, Catherine. Well, we move on to our meeting summary from the last meeting. So at this time, we will move on the February 24th, 2025 tax summary meeting. That was attachment A in your packet. Is there any discussion, corrections, or questions about the February 24th, 2025 TAC meeting? Seeing none, we will make those stand as approved. Moving on to our action items today, we do have 2 action items. Up first, the Federal Transit Administration Section 5310 and Human Services Transportation Set-Aside Recommended Projects. This is attachment B in your packet, and Travis Noon, Program Manager with Administration and Finance, will be presenting.
Right. Thank you all for having me. For those that don't know me, I'm Travis Noon. I'm the Manager of Business Operations for our Area Agency on Aging. And I have for you all in your consideration today the recommended awards for Federal Transit Administration Section 5310, as well as the Human Services Transportation TIP Set-Aside. Just for a quick reminder on what these funds are for, so DRCOG is a designated recipient of Federal Transit Administration Section 5310 funding for the Denver Aurora urbanized area. And that funding provides about $2.9 million annually to fund capital, operating, and mobility management projects across the region that benefit older adults and individuals with disabilities. In addition, DRCOG's Board of Directors set aside $8 million over the 4-year TIP period for 2024 through 2027 for the same projects, but expanding it beyond just individuals with disabilities and older adults to other vulnerable populations as well. So we do release an annual call for these projects, and this year we released that call for projects in November 2024. We received proposals from 10 organizations that totaled requests of over, about $5.8 million, sorry. And there is approximately $5.3 million available for the period July 1, 2025 through June 30th, 2026 between both 2 funding streams. All these applications are reviewed and scored according to our 5310 program management plan, and they're reviewed by a panel who make these recommendations for you all to consider. The recommended awards are in your packets as well. I have a couple slides here and I'll highlight a few things here. For the most part, pretty much all of the awards were recommended for funding. Some of the vehicles weren't funded that were asked to be replaced. That was due to the mileage not being outside of useful life standards on those vehicles. And then there was one project, Eaton Senior Communities, that wasn't funded, and it was as they were deemed ineligible for the funding. DRCOG, most of these projects are pretty familiar if you've been here through the few years that we've done this. We fund a variety of things, including capital projects. You'll see here there's vehicles for the most part, software projects, and some other capital projects. Mobility management kind of runs the gamut of different things, which could be travel training, it could be coordinating councils. It also includes trip brokerages, which really is where most of that mobility management funding goes. And then, of course, we provide traditional operating assistance as well. So this is the kind of the first half of the list here, and then the second list here of these projects. You'll see there's some EV infrastructure and EV vehicles being purchased as well, and some different capital projects there. I have the recommended motion for you all here, and I'm happy to answer any questions that you all have.
Yes, any questions? Looks like Tom.
Thank you, Chair. Just one question. On the breakdown of the 5310 and the HS funds, do you know how that's going to go towards each one of those applications yet? For example, Douglas County?
Yes, I do. And it depends. For the most part, it was how they asked for it. So they submitted applications individually for each of these two funding streams, and it was allocated. What they asked for is, for the most part, is what was recommended, and it's being allocated. Currently being allocated as they had asked for it. Subject to change. Right now, we don't have the full apportionment for federal, for 5310 funding. So I'm working off of an estimate based on partial year apportionment, so it's subject to change depending on when we get that full apportionment.
Thank you. Any other questions or comments? Yes, Ron.
Thanks, Travis. Appreciate your work on this program continuing forward. It's really important for the region. Sorry I didn't give you a heads up to this question ahead of time, so don't, you catch up with me later to chastise me. But for those around the table, can you just refresh our memories about the 5310 allocations for the areas outside of the Denver-Aurora urbanized area? Who handles that funding and how that funding is allocated?
Sure. Yeah, so the 5310 funds are apportioned based on the urbanized areas. The large UZAs, anything above 200,000, has their own designation, own pot of money, and it goes to them. There's really only two of those within Colorado Springs, and then DRCOG, the Denver-Aurora urbanized area. And then everything else is apportioned directly to CDOT, and CDOT manages those funds in a competitive call for projects.
Any other questions? Look like Tom has a follow-up.
Follow-up, but the HST funds are not geographically restricted.
Well, it's part of DRCOG's TIP, so it would be within the MPO boundaries. Yeah.
Okay, thank you.
Yeah, thank you for that clarification. Any other questions or comments on this item? All right, seeing none, do I have a motion? Yes, David Krutzinger.
David Krutzinger, Denver. I move to recommend to the Regional Transportation Committee to approve the Federal Transit Administration Section 5310 and Human Services Transportation Set-Aside projects for the period July 1st, 25 through June 30th, 2026, as recommended by the review panel.
Thank you. And a second?
I'm not seconding, I just need to indicate that since Via Mobility Services is on the list, I'll be recusing.
Thank you very much. Yes.
I'll second.
Okay, we have a first and a second. So with that, could all in favor please vote by saying aye?
Aye.
All those opposed signify by saying no. And for the record, any abstentions? And Frank. Okay. Thank you very much, Travis. Appreciate the information. Up next is item number 5, the fiscal year 2026 to 2029 Transportation Improvement Program. This was attachment C in your packet, and Todd Cottrell, Project and Program Delivery Manager, is going to give us the update.
All right. Good afternoon. Thank you, Mr. Chair. But you guys thought you'd get rid of me, huh? Haven't been up here in a while. All right. So this afternoon, we are looking for your recommendation on 2 documents, essentially. The 2026-2029 Transportation Improvement Program, or TIP, and the ozone conformity determination. Before I go forward, I just want to outline what exactly is on our website and what is out there for your review and eventual recommendation. So on our website, we have Appendix F, which is the individual project descriptions. We have that separated out, both as a PDF and as an HTML document that's accessible. So just more of an FYI for that. It's all part of the TIP, but we wanted to separate it out just because it was a larger file. And then Thursday, after our board meeting and our public hearing that we had in this document, on both documents, we had an addendum sent out to this committee. The first was an errata sheet. Errata sheet outlines all of the proposed changes from staff or through TIP amendments since February 12th, when the document was released for public comment. And then we also have the public comment that was submitted throughout that entire process, which is for your review. Right. So before we get into what the tip is, I just wanted to take 30 seconds and sort of provide a little bit of context about programming here at DRCOG. And everything really stems from MetroVision itself. One of those themes within MetroVision is transportation, in which, from a staff perspective, it's really looking at the Regional Transportation Plan, or RTP. You know, this document is looking out 20 years. It is outlined, or the individual projects listed in the document are outlined in several different ways. So, for example, we have the vision projects, which, if money was not an issue, it would say this is what our region's needs are. However, that is not always the case, so we're looking at fiscally constrained projects, or a listing of projects, or programmatic investment categories of what we think we can afford over that 20-plus year time frame. And of course, those projects are outlined in different ways throughout the document. And finally, we have the TIP itself, which implements the RTP. So I'm sure most of you know, but just in case, what is the TIP? Short-range 4-year planning program. So all of those individual projects that we have listed in the document, they're all going to contain their individual and very specific and dedicated funding for each year, for each individual project. Not only does it contain projects that are selected using the DRCOG control funds, but it's also going to be able to contain all federal and state-funded transportation projects. So whether that is through RTD, through CDOT, or another local agency, if that project happens to be regionally significant for air quality. Federal law indicates that we must create one of these new TIP documents every 4 years. However, because of CDOT and their statewide transportation improvement program, which is produced on an annual basis, we create a new TIP document every 2 years. And again, that's just to make sure that our planning horizon years are all lined up, or fairly closely. Major calls for projects do take place every 4 years, though, instead of taking those calls for projects with every new document. So in effect, the most important takeaway for this 26 to 29 TIP document is that we did not do any calls for projects for that. Most of the projects that you will see in there simply have been rolled over from the previous TIP or previous TIPs. And I'll explain that more about that previous call in just a second here. But this document is not static. So 3-4 times a year, you will see Josh up here explaining about our TIP amendments on a policy level. We also do administrative modifications probably 11 or 12 times a year. Talking about those previous calls, and for those who were around when we did them, they were a lot, and I will certainly agree with that. But because of various circumstances, we actually did 4 calls for projects, all back-to-back throughout 2022 and 23. Approximately $500 million in DRCOG allocated funds. Once we add in the local match, we're talking about, you know, $700 to $800 million that was allocated 22 through 27. Like I said, it's a little bit different than what we have typically done in the past. We did that over 2 TIP cycles in over 6 years. By the chart that you could see on the right-hand side, a majority of those did deal with active transportation, and that was mostly because of the way that we conducted the calls, but also in tune with what we have been seeing over the years throughout just some general TIP projects. One thing to really point out about the roadway, that 14% of those roadway projects, almost all of them did have some type of active transportation component. So you can see how this would really lay out when we look at that $500 million in investments. Just want to take a second and talk about air quality conformity. Because of our non-attainment status for ozone, we essentially, through our plans, must reduce pollution. And when we look at this conformity, it is not based on individual projects. It's essentially based on a collection of individual projects throughout the entire regional transportation plan and the TIP. Excuse me. When we took a look at the draft 26 to 29 TIP and noticed that there were no new regionally significant projects contained within that document, we were able to use the previous federal emission tests and the statewide greenhouse gas reduction analysis for this 26 to 29 TIP. So therefore, we did not do any new analysis because, again, we were able to use those past documents because there was no regionally significant projects that were added that weren't in those previous documents. A little bit about the actual public process that went in. Like I said, we kicked off this public process back on February 12th. There was numerous notices on the DRCOG website, including the homepage, our TIP webpage, and then we actually had a separate engagement page that was created. I believe we did 2 e-blasts. We had a notice within the Denver Post. We had weekly social media campaign to the 4 major sites here that were listed. And then that all concluded this last Wednesday evening at the March 19th public hearing. So with that, be happy to take any comments or questions you may have, but there is a proposed motion here if you're so entitled to.
Thank you, Todd, very much for both the background and the information. Any questions or comments on this item? Yes, Brian Weimer.
I'll make a motion. But before I do that, I'd like to recognize Todd because you being out of sight, you're never out of mind and heart. Particularly after 4 calls this last TIP segment.
Well, and I'll spoil that a little bit because I will be back here next month with some additional information.
And we'll be looking forward to
I bet you will.
So I move to recommend to the RTC the 2026 to 2029 Transportation Improvement Program, including those adjustments contained within the errata sheet and the associated air quality conformity document.
Second.
Thank you, Brian. We have a second from Maria. So with that, first and a second, thank you very much. We will now vote. Again, all those in favor, please signify by voting aye.
Aye.
All those opposed signify no. And are there any abstentions? Didn't expect it on that one. Okay, thank you very much, Todd. Appreciate the information, and I shadow Brian's comments, so thank you very much. So with that, we are moving on to our discussion items. So the first of our discussion items today is item number 6, the Colorado Department of Transportation Transit Connections Study Overview. This is attachment D in your packet, and Cole Nieder, Senior Planner, will be presenting. And that's a pretty awesome photo on the front there. So.
Good afternoon, everyone. My name is Cole Nieder. I am DRCOG's Senior Transit Planner. I'm here to introduce the CDOT Transit Connection Study that's going to be presented by George Gromke. He's a transit planner with the CDOT Division of Transit and Rail. The Transit Connection Study is a visioning project to inform CDOT's transit planning and investment decisions to build out a better, more connected statewide comprehensive transit network. Since the Transit Connection Study includes analysis on multiple modes of transit, including Bustang, passenger rail, and BRT, for example, this is relevant to our work and DRCOG's work in the transit space, including DRCOG's BRT partnership, and we look forward to that continuing collaboration. George is unfortunately unable to be with us in person today, so he will be presenting virtually. Regardless, you can't see his face, but he is listening to your guys' questions after the presentation. So feel free, I'm going to pass it to him, and feel free to have any questions at the end as well.
Hello, can you hear me all right? Can you hear me in the room?
We can hear you, but we're trying to get a little more volume in the room here.
Awesome.
All right, George, if you want to give it a try one more time.
All right, can you hear me now?
Yep, that works. Go ahead.
All right, I can, yes, we'll keep speaking up. Thanks, Cole, so much for the introduction. As Cole said, I'm George Gronke. I'm a transit planner with CDOT's Division of Transit and Rail. I'm here to present today in the Transit Connection Study. I apologize, I am not there in person. So thank you all for bearing with me for that and for listening more closely with the quiet audio. Next slide, please, Cole. So to start, just for background, CDOT Division of Transit and Rail, we're under the Office of Innovative Mobility. We have three main groups, transit planning operations, transit programs, and passenger rail branch for background. And so next slide, please. We're currently, in the process of a couple of things. And so on one end, there's the Bustang Family of Services. So here, of course, this map depicts our current service levels. So our main line that runs I-25 north and south, as well as I-70 west from Denver to Grand Junction, running at more express service levels. And we've had recent frequency increases to that service. And then Outrider, so our rural connecting service. So everywhere from Craig to Denver to Sterling to Denver, from Durango to Grand Junction. So those services serving more of an essential network need, connecting areas across the state that don't oftentimes have as much access to transportation, with decline in private carrier networks and our seasonal services. So things like Bustang to Estes and our Snowstang service. Next slide, please. And then on the other side of house, another big thing we're working on project-wise is, of course, the Front Range Passenger Rail and the Mountain Rail projects. And so, these building up to create, more substantial rail opportunities and connections throughout, our busy Front Range corridor, and then the Mountain Rail project, currently in phases, but eventually from Denver to Craig. Next slide. And the reason for these two things to start us off is that currently CDOT is in a number of different plans and studies. And so, we're currently updating the statewide transportation and transit plans, working with our, rural TPRs to get their updates to their transportation plans. And additionally, CDOT is currently undertaking the development of our Bustang business plan and looking forward to future optimization of that service. And with the upcoming Front Range Passenger Rail and Mountain Rail projects, the state has moved forward with the Transit Connection Study. And so the Transit Connection Study aims to provide a strategic vision for connecting a statewide transit network. So this improves expanding the Bustang family of services, adding passenger rail services, and fostering connections with intercity, regional, and local transit providers. And the study will help to inform CDOT's transit planning and investment decisions for the next decade. Next slide. So the TCS envisions a future in this statewide transportation network that is comprehensive, integrated, accessible, and equitable, sustainable, reliable, and foster strategic growth. And so we're using these core objectives to guide this report and the vision that we have for the state in further developing Colorado's statewide transit network and connecting level or different transit providers at different levels. So from local to regional to Bustang's family of services. Next slide. So the TCS overview. For the process, it's broken up into some key sections. So the current state of transit, which is our existing conditions, our gaps analysis, our recommendations, and the development of our final report. We have drafted the current state of transit and finished that. we've worked with a consultant in supporting us with our gaps analysis portion of this report. So identifying network gaps, so focused on temporal and spatial gaps across the state. So really with a focus at that inner-city, inter-regional level and regional gaps as well, and where opportunities exist to fill those gaps and to further connect the state and services across the state at those different levels. And really the outcomes here are focused on a provision of data. So using this report as, in some ways a North Star and helping to guide, future planning decisions and to help inform planning decisions about, interregional and regional connections and gaps within our network and where those can be filled. And developing a transit priority framework. So taking those different gaps and developing projects around those gaps and a prioritization of those projects. So, in working in step with a lot of the work we're doing on the busting side of house and where we can have the largest impact, with potential service optimization and expansion, developing a framework of those regional and interregional gaps across the state, and where we can have an impact and where it can inform others about gaps and opportunities for connections. And then other big outcomes, integrating state-supported services into a statewide transit network. And as I mentioned, the further expansion optimization of the busting family of services. Next slide. So this was just a couple of examples of some of the things that we have identified in the current state of transit. So, of course, including state-supported services. Next slide. Taking a comprehensive view of, different transportation across the state. So, recognizing this is just showing fixed route, but at different levels, local, regional, interregional, services from busting to our intercity private carriers to Amtrak, down to our local providers, and, additionally, looking not just at fixed route, but also demand response services as well and their service areas across the state, and recognizing that some project outcomes, aren't going to be a new fixed route bus, but very well in some of our rural areas, may be a potential lack of coverage that could be filled by, a demand response provider or an expanded service area. Next slide. And so, as I mentioned earlier, these are the major study elements. The current state of transit is drafted. The gaps analysis we just completed. So it was underway, but we've completed that. And next is building our recommendations. So developing the report, building the transit priorities framework and final report, a story map to go along with this. And to back up a little before that is, providing more outreach. So an opportunity to share our findings with our stakeholders and for them to review the report, provide feedback, and moving forward with that to help inform the final report that we have. Next slide. And that's what I have today for a status report for the TCS. Thank you all for your time and happy to take any questions.
Thank you, George. Does anyone have any questions regarding the presentation? Ryan Weimer?
Thank you for the presentation. One of the glaring gaps that I see at this point is on I-70 going east of the metro area. What did you find as part of the analysis in your gap perspective, and are you making any recommendations, at least at this point?
Yeah, so there's twofold to that. Yeah, and so as a part of this with our gaps analysis, there was a Bustang focused component and a more statewide focused or a broader statewide gaps analysis. So, and taking those two pieces, right, and where from a statewide perspective, where there's, different gaps and needs, and have that also informing kind of the Bustang portion. So, and looking at our existing levels of service, and kind of, taking other pieces like, what our current, operational constraints are, or costs, and what opportunities we have to kind of expand service and what that looks like. And so, that is kind of in step informing that. And, in regards to, another part of this process is that, we have worked with a lot of our rural TPRs and, interview different transit agencies to get feedback in regards to a lot of the work that they've done on different gaps and needs. And so that does come up through, a lot of different channels as a gap in service. And, with what we worked on with the gaps analysis, there also, is a pretty clear gap there. So there is, especially for a service like, Bustang Outrider, there is an opportunity to connect that part of the state. And it is something that we are closely looking at moving forward. So.
Thank you, Brian. Yes.
Thank you, Justin. Matt Callison, City of Aurora, Arapahoe County. Thank you, George, for the presentation. I would also echo, you make mention of a strategic planning component in this overall transit assessment effort on that. And we'd be very anxious and look forward to coordinating in terms of the land use, because that whole Aerotropolis area east going out to Watkins and actually beyond Watkins is experiencing unprecedented development. And we've been working and coordinating with partners through a northeast Aurora TDM effort. So we have some information that I think would be relevant and current to this existing effort. So we look forward to collaborating with you. And actually, can you point us to where your draft gap analysis study is available on your website, project website? Thank you.
Yeah, thank you very much for that. I appreciate it. And we just got those gap results, so we're currently drafting that, but should have that up shortly. And so, yeah, we'll have that up on the website that I have there, and more information and an update to, to that draft report available for review here shortly. So, yeah, we, hopefully within the next 2 weeks, we have that up and available for review. So thank you.
Thank you, George. Yes.
George, thank you for that presentation. This is Jean Sands of Boulder. Just a couple of procedural questions. So it sounds like the current state of transit is drafted and will be available for review in the next couple of weeks, which we look forward to reviewing. Just procedurally, how do we obtain that? Will you be sending that out to the DRCOG TAC, or how should we expect that to be released?
Yeah, I think that's a great question. We've the list we have currently is we have been working with various rural TPRs and presenting to our different MPOs, and with trans agencies. And so, I think we would definitely like to have, this available to, we've kind of been, saying key stakeholders, but in a way I do understand that, can be selective. So I think that that would make sense to potentially, go through DRCOG, and maybe, I can work with and follow up with, the right point of contact and how that might look to distribute it to folks here today at this meeting. So.
Thanks for that. I don't mean to volunteer DRCOG at all. I just want to be sure. I know that, all of us around the table are very interested in this. In fact, I think I have some comments on the state of transit report that I'd like to provide. So just making sure that those connections are made, we'd appreciate that. And then my next question, again, I said it was a procedural one. How does this relate, and how will it inform the CDOT 10-year plan?
Yeah, so we're working very closely with the 10-year plan and with those efforts that are ongoing. So, we have, as we've gone through this process, we've kind of been in step with them. I think the big piece where this study especially the focus, at the broader, regional and interregional level is especially in regards to, the development of, potential busting projects and, how those impact the projects that are currently on those lists and changes that, in the way that, we kind of move forward and how that helps to inform, our project or our decisions and how, we help to advise, right, of any potential CDOT projects that are elevated as a result of this study, for inclusion on those lists of projects. And so, that's kind of the bigger impact. And, I think we also recognize the timing of this report isn't ideal, given that we do have a lot of planning efforts moving forward. I know that, DRCOG's, their plan is finalized. I know, Pikes Peak is, I think there's in a draft position. And so, a lot of things the TPRs are getting kind of their project list and their, kind of regional plans developed. And so, I think in the future, we would like this to be something that is updated, periodically updated to help inform those planning decisions and those project lists. But given the time and the development and outreach we've had thus far, I wouldn't suspect that would get to that point for this 10-year plan update process or this statewide transportation plan process. But optimistically in future iterations of that plan.
Thank you.
Thank you, Gene, for that question. I believe Ron has some additional information as well.
Thank you, George. Ron Papsdorf for DRCOG. Gene, thanks for queuing me up. George, I think it makes sense for you to get draft documents to Cole, and then we can distribute out to our TAC membership for their review and comment back to you. DRCOG will likely have some comments as well. On the larger issue, I think it's helpful that CDOT is doing this sort of statewide transit planning work that really looks at sort of the regional connections around the state and sort of the big statewide backbone work. That will be informative for all of us as we continue our work over the next 12, 18 months developing DRCOG's next 2050 regional transportation plan and laying out specific transit priorities within our region, within that statewide context, but much more specific for our region, leading to sort of our regional agreements about our regional priorities for transit.
Thank you, Ron.
Thank you, Ron, for that clarification. All right, other questions? I think I saw, David Krutzinger and then Michelle.
David Krutzinger, Denver. Thanks, George, for your presentation and tagging on to Ron's comment. I'm interested in making sure that the needs and gaps analysis shows the critical connections around the state where the intercity bus and rail system, so Amtrak, Greyhound, and Arrow, Black Hill Stage, those come together with the busting system. I think, as you know, Greyhound's intending to move out of Denver Union Station, so where they land and how those connections get made is pretty important. Thanks.
Yeah, that's a great point, and I appreciate that. So, I will say Cole has been incredible in making sure I get you all the most up-to-date resources. I will say that as I said, we've kind of been looking at those pieces and moved forward, and so in a future potential resources to share along with the work that we're doing with the draft. I think some of the methodology would be helpful, of course, that I didn't present on today. I think a big piece of that is recognizing those we have a lot of those private intercity kind of legacy carriers, and that has over the last 10, 15, 20 years, 5 years, been changed considerably throughout Colorado. And so, then there's areas, right, where busting potentially fills that gap. But what does that mean, for interstate travel beyond the state? And what does that look like? Greyhound has also, or FlixBus has also pulled out of Grand Junction. And we are, aware that they are, like you mentioned, pulling out DUS. And so, considering those factors and, another big piece we've done with this study, which I'm excited about, is, when we're looking at kind of gaps and needs across the state, we do have your more traditional activity centers as a portion of this study. So, kind of your classic population density, jobs density, kind of those indicators for these activity centers, but taking it a step further, and also including kind of your more essential service and recreational spots. So, in looking at airports and, kind of critical stations like Amtrak stations and, Rocky Mountain National Park and, essential service locations, right, where that fall outside of your urban areas, where there's gaps or needs in transit. And so, yeah, those are pieces I think which, potentially on a, maybe very demand travel or transit demand focused analysis might, fall through the gaps, but I think are critical, especially when we see a lot of our, kind of intercity private legacy carriers kind of, changing their service levels and kind of, their service portfolio. So I will step off of that, what feels like a soapbox now, and give it back to the room for questions.
Thank you, George, and a lot of good points in that. So thank you for sharing your soapbox there. I think we had another question from Michelle Melanakis.
Thank you. Michelle Melanakis, Boulder County, City of Lafayette. Just a question about how this project coordinates with already known transit gaps and needs through organizations like RTD or Transport, and how that coordination is working.
Yep, that's a great point. So, a big piece that is informing this plan, in recognizing, or sorry, not this plan, this study, and recognizing, kind of our approach, is that, we did do a fair amount of outreach to, transit providers across the state, helping to understand anything we're missing, but also, taking gaps and needs identified in the last 10-year plan iteration, statewide transportation plan updates, taking those long lists of projects and those databases and looking at those, and then, going across the state and looking at, projects and proposals and plans and studies around, around transit. So everything from, the Colorado 7, which I know is more local or regional to you all, but the Colorado 7 corridor, changes happening there, to gaps and needs for different counties and regions that have been done since the last statewide plan updates, and collecting these different resources to help inform what we're doing, and to better understand what's been done and what's coming. So I think the Mountain Rail and Front Range Passenger Rail are kind of a good example of that, even though it's internal in the sense of, we recognize that they don't currently exist, and they're, in the process of being planned, but considering those impacts, and, their position as kind of a plan project and what that looks like, in the future, for the, in the future statewide transit network, and potentially what that looks like for how they interact, and help to connect people from a statewide perspective. So thank you.
Thank you, George, for that. Any other questions or comments? I did have one question myself.
Yeah.
And when we talk about the routes, right, all the mapping, these show how all these facilities kind of work and fill these gaps. But I guess the other side of it, right, is the ability to access or operate in all those systems. And is that something that this study's looking at? Is it a recommendation? We've talked a lot about, you want to transfer from the Mustang to light rail to other systems, right? There's not a great way to do that currently at any kind of regional level. So just curious if that's something that's been thought about yet, or something that could be at least mentioned as part of this study.
Yeah, I think there is, one of the big things we're all looking at, is service gaps as a piece of it. So, yeah, we're across the state, right, evaluating connection types. So, where there are shared stops, where there's connected stops, where, there actually is a transfer window that makes sense, right? Under a time threshold, right, of of say, 30 minutes, or potentially your kind of, bigger key, intermodal hubs, right? Where you have a connection between 3 providers or so. And so that is something we are looking at. I will say that, a piece where, we've drawn a line for this study, but we hope potentially, in future iterations or another study is some of the first last mile pieces. So, in recognizing, right, where maybe it's not a direct stop, where there's opportunities, right, to people to connect to different transit or, connections, right, that fall within that first last mile category that wouldn't be in this study. But yeah, there is a portion of it that does fall into what we're doing in regards to, transfers and service alignment and schedules and gaps that exist from that point of view. So thank you.
Well, thank you, George. And I think that'll be very helpful to start to identify some of those priority transfer locations. And then I know our partners, like, we work with Denver South, a lot of other regional partners, and how we can maybe develop that to the next step at that more local level. So great. All right. Well, thank you, George, very much for your time. And thank you, Cole, for the presentation.
Yeah, thank you very much. Appreciate your all's time today.
And up next, we have item number 7. This is the Ride Alliance overview. This is attachment E in your packet. And Mallory Miller, Senior Project Manager, will be presenting.
All right. Hello, everyone. My name is Mallory Miller, Senior Project Manager here at DRCOG. This is my first time presenting to TAC, but I've actually been working at DRCOG for almost 4 years. So prior to this position, I worked in the Area Agency on Aging Division and managed the Transportation Services Program that provides free transportation for adults 60 and older throughout the AAA service region. So through that position, I understand firsthand kind of the challenges that human service transportation providers are currently facing. So when the Ride Alliance opportunity opened, thought it was a good fit. So why is something like Ride Alliance needed? So last year, there were almost 12,000 trip denials between DRCOG transit contractors. So that is almost 12,000 times that an older adult couldn't get to the doctor's appointment that they'd been waiting, weeks or months for, couldn't get to the grocery store to get food for the week, or wherever else it is that they needed to go. Additionally, this 12,000 only applies to DRCOG contractors, so it doesn't capture the full regional need of trip denials. That true number is likely much higher, as it doesn't, again, include non-DRCOG contractors. So right now, there's no coordination between providers. So what this means is there is a significant burden on clients seeking transportation services to understand what their options are, which providers service which areas, how far in advance they need to schedule, if there is a cost they need to pay for services. All of that is put on our aging population to navigate. Additionally, a lot of transit providers have a wait list for services. And the reason why folks have a wait list is because our older adult population in Colorado is increasing astronomically. So in the next 5 years, by 2030, Colorado will see a 27.8% increase in the older adult population, or 1 in 5 persons will be over the age of 60, which is almost 1.2 million people over the age of 65. So we are one of the most rapidly aging states in the entire nation, and it speaks to an urgent need to identify solutions that can improve coordination, ease of access to services, and ideally reduce those trip denials for older adults. And so that's where something like Ride Alliance comes into play. So the goal of Ride Alliance is to develop an open source trip exchange hub which acts as an intermediary between different transit agencies' unique softwares. So the Trip Exchange Hub allows for the seamless coordination of trip and client information between different transit providers. And what this does is create a no wrong door approach for clients seeking services. So clients can now contact a single participating provider, share with them their demographic and trip information, and even if that provider can't provide the trip, they can send that information to the Trip Exchange Hub for another provider to take the trip. So this maximizes our available resources in the region by allowing providers to continue using their existing softwares and program models, but it also gives them the opportunity to pick up trips that they might not have been aware of before. So they could, for example, go into the Trip Exchange Hub and see that Tom needs a ride to Denver Health, and they're already going to Denver Health on that same day, taking another client. So now they can take on this additional trip, thereby, improving their vehicle, spending ratio and increasing the number of clients that get rides. Additionally, this also helps eliminate the silos that a lot of providers experience by having their funding restricting them to serving specific areas. So the Trip Exchange Hub will allow for the coordination of multi-stop trips across those service boundary lines, which is an increasing need given the state of, kind of healthcare and folks needing to kind of go all over the place to get their medical appointments addressed. So Ride Alliance is not a new project to the Denver region. Some of you might be familiar with its history, but it started with the Mobility Services for All Americans grant. This was actually led by the Denver Regional Mobility and Access Coalition, or Dr. MAC. It's what developed the first iteration of the Trip Exchange Hub. The project was continued with the Veterans Transportation and Community Living Initiative grant, which was taken over by DRCOG. So through the VTCLI grant, they really developed the Trip Exchange Hub. They had integrated transit providers and were kind of all set for pilot testing when a perfect storm happened. So that would be the COVID-19 pandemic, which meant that there were no longer any trips to test during the pilot phase. And additionally, some of the technology that was originally used ended up getting sold to another company. So what that means is that the Trip Exchange Hub ended up being turned off in 2020 and was turned off until more funding could become available. So a funding opportunity presented itself through the bipartisan infrastructure law, which created the Strengthening Mobility and Revolutionizing Transportation, or SMART grant. So the SMART grant awards innovative projects across the nation. And it's a two-stage grant. So stage one grants are really focused on, planning and testing. And then stage two is very heavily focused on implementation. So we received around $975,000 last July 2024 for stage one with the goals of enhancing the Trip Exchange Hub, integrating providers, and finally being able to test the functionality and effectiveness of the Trip Exchange Hub. This is an 18-month grant, so it's scheduled to end in January 2026. For this project, we are soliciting consultants' expertise through Demand Trans and Transit Plus. Both agencies have actually worked on previous iterations of the Ride Alliance project. Both have worked on kind of similar projects elsewhere in the nation. For example, Transit Plus worked with the North Front Range MPO on their Ride No-Co project. And both are helping develop transactional data specifications on a national scale. Additionally, Demand Trans was the agency that originally built the Trip Exchange Hub. So having these two groups' technical expertise and experience is invaluable to project success. Of course, the Trip Exchange Hub would not work if we didn't have partners. And so some of the folks listed here are folks who submitted letters of commitment back when we originally applied for the SMART grant, as well as some organizations that we've come into contact with as the project has restarted. So we do anticipate that more providers will become involved as the project progresses. And for example, we've already started working with like Lakewood Rides, who is not on this slide, but just to give an example, we will continue expanding this group. So to kind of explain how the Trip Exchange Hub works and why something like that is even needed, we'll kind of walk through the technical side of things. So the chart on the left shows interoperability using proprietary APIs. APIs are application programming interfaces, which is just like a technical term for connecting two different softwares together. So in the chart on the left, if we can pretend that A, B, C, D, and E are all different transit providers, we can see that for example, A would need to build 4 APIs in order to talk with the other agencies. So in this model, without a Trip Exchange Hub, for these 5 providers to connect, that means 20 APIs need to be built. So ultimately, there is a limit to how many providers could connect and communicate with each other due to the cost of building and maintaining these individual APIs. So the chart on the right shows how it would work with the Trip Exchange Hub. So in this same scenario, A, B, C, D, and E are all transit providers, but this time they are all connected to each other through the Trip Exchange Hub in a single open API that uses transactional data specifications. So in this model, it's almost limitless how many providers can connect in, because for example, if B were to make a change to their software, only the Trip Exchange Hub needs to update that single API, and that communicates the change out to everyone else. So it's much more cost effective, much more sustainable, and allows for many more folks to connect and communicate with each other. So while there are many, technical and financial benefits to the Trip Exchange Hub, there's also a lot of benefits to clients and staff working at the transit agencies. So let's pretend there's a client, Jane. She is, over 60. She normally drives, but she recently had a bad fall and needs to go to physical therapy for the next couple of weeks, and she can't drive herself to that physical therapy. So she calls her doctor, who, connects her to the office's social worker, who then refers her over to Dr. Mack for travel training and information and assistance. Jane gives Dr. Mack some of her demographics and her trip needs so that they can provide her with appropriate transportation referrals. So Jane ends with Dr. Mack. She's got her list of transportation providers who might be able to help her out. So she calls the first one. She gives them all of her demographic information, all of her trip information, just to find out that unfortunately they're on a wait list, and so they're not going to be able to help her out with her immediate trip needs. So Jane calls the next company. She gives them all her demographics, all her trip information, and while they don't have a wait list, they're unfortunately at capacity that day, so they won't be able to take her either. So Jane calls the last client on her list. And again, she gives them all her demographic information, all her trip information. And fortunately, this agency is able to help her out. But at this point, Jane has now spoken with 4 or 5 different agencies, given them all the same information. She's probably feeling a little bit frustrated at how much time it took to get a ride. And she's probably feeling a little scared for the future when she's permanently no longer able to drive and fully reliant on transit services such as this. Additionally, 4 different agencies all talked to Jane, all helped the exact same client, all gathered the exact same information. And so the ideal experience, post stage 2, once Ride Alliance is fully built and established in the region. So the same scenario with Jane. Jane needs medical rides temporarily. She calls her doctor. Doctor connects her over to Dr. Mack. This time, Dr. Mack is able to talk to Jane about the Ride Alliance project and Trip Exchange Hub. Dr. Mack collects all of Jane's demographic and trip information and gets her permission to send it to the Trip Exchange Hub. This time, transportation provider C, or the last one Jane spoke with, is able to log into the hub, can see this trip request. They can say, yep, we can do it, and they automatically get all of that demographic and trip information sent to their unique scheduling software system. So they just need to call Jane and let her know that she is all set for her ride, what time the driver will be there, and any other, necessary program policies. But in this situation, Jane only spoke with one provider to give them that demographic and trip information. Transportation provider C was automatically able to get that thanks to Dr. Mack collecting that information and the Trip Exchange Hub. So it's a much more effective and efficient system for both clients and staff. And so our goals for this project, kind of some of our immediate next steps, are working to get memorandum of understanding agreements with providers for participating in the pilot, which we anticipate will run this November. And then we'll be working on API development and integration for those providers into the Trip Exchange Hub. We'll be working to further update the Trip Exchange Hub so that it's more useful for providers who are using it. And then, of course, we want to actually pilot this for about 4 to 6 weeks to test the effectiveness. And then we would, of course, apply for stage 2 funding so that we can actually, make this a permanent reality in the Denver metro region. All right, do folks have any questions?
Thank you, Mallory, for that presentation. And this is one of those items, when I read it, I did not know what we were going to be presenting today. So I think that's a really exciting topic. I appreciate it. Yes, Chris.
Chris Joven, City of Westminster. We're getting ready to restart senior services with VIA coming up this probably Q2 this time around. But one of the things that we found when we had the service back in 22-23 was that residents that wanted to use their system know how to game the system in terms of making their reservations ahead of time where they could get 6 or 7 stops out of one usage, out of one day, therefore boxcarring out other people trying to come in. Would there be something like that, those type of backstops put into place through this hub where you only get a minimum of like 2 or 3? Like VIA has put in backstops and firewalls now. You're not allowed to make that many reservations on one day. Is the hub going to be something similar? Thank you.
Yeah, that's a great, that's a great question. So I would say in general, the only trips being sent to the hub are trips that agencies can't directly provide. So if the agency can do the trip, they're not going to, send it to the Trip Exchange hub. So I think that will limit the potential abuse of that system because folks would be able to see if there were multiple requests for that exact same trip.
Yeah. Yes, next question, Frank Bruno.
It's not so much a question again, but I just want to say thank you, Mallory. Obviously, we've been working quite a while, and also my colleague from Little Help there. Chris, to your point, you're absolutely right. We have seen over years how people have figured that out, that they can game the system, and then we become really providers for a select group of people, and that's never been the intention of our service. We've been around 46 years, and that breaks our heart that we've had to say no to people. So we've actually taken lots of initiatives to change that and limit. We sent out a letter last fall indicating to our ridership that we're making changes like that. They're going to be limited. We might even do things like in terms of distance, but that gets a little dicey too. But anyway, we're very sensitive to it. I think Mallory would agree that the need is much greater than anyone can imagine. That 28% increase that we're seeing, that rise in people over 65 versus people under 18, there's a whole host of economic challenges that's going to pose. But we work closely with our colleagues here at DRCOG. Years now trying to figure out how are we going to meet that demand, and route matches software, when that really became obsolete and was purchased for destruction, didn't help. So I think this is going to be a game changer for all of us. So thank you, Mallory.
Thank you. Appreciate VIA's support and a little help as well.
All right, thank you, Frank. Next, Justin Begley.
Thanks, Mallory. Appreciate the presentation, and I want to also give credit to DRCOG. So I remember when the Human Service Transportation Set-Aside was created, this is what you said was going to be made possible. I'm just curious if there's any linkage between the grant match or anything set aside, but I was curious about that back then, and here it is, so great job. But then also, I think Chris spoke to the question I had, which is like, this is very much presented as a benefit to users, and totally understand all of the, inefficiency that can be squeezed out on behalf of the user. Does it create opportunity in the future to have greater regionally organized human service transportation in a way that might be a little less obvious just through what's been?
Yeah, that's a great question. So I think, with stage one, we do have limited funding, and the goal is just to really get this off the ground and test it. But with stage two, I think there would be really significant opportunity to look into those enhanced features to really improve regional coordination. Like, can we add, work with some scheduling software that can do route optimization so that, more folks put in all of their, trip manifests, not just the trips have been denied. But I think those are things that come more with stage two. When we have more time and more money to make those advanced features possible. But additionally, one thing that will happen with stage one is the Trip Exchange Hub does have the ability to export reports and, has data storage in there. And so it is kind of creating almost a repository to collect that regional data on the amount of trip denials, where folks are traveling to, what are the hot spots. So with stage one, there will be some data collection happening, but I think with stage two, that's when we can really look at how do we maximize everything.
Yeah, thank you, Chair Schmitz. I want to add to Mallory's excellent answer just to address your first point, Justin, about the relationship of these things and the grants. So the stage 1 grant in which we're working in now and Mallory's presented on was 100% federal share. So we were lucky to get that grant and to advance this work. The stage 2 grant opportunity, if it comes, it's supposed to come, we'll see, would make many more dollars available, but those would come with a match requirement, and that's something that we will need to figure out when that time comes. In relation to the human service transportation tip set aside, I'll defer to Mallory here, but I think, you know, over time through this project, as we advance this work, we will need to figure out things like who maintains the hub, you know, that sort of steady funding source to keep this going over time. You know, can that come from the HST set aside? Does it come from another source? I think those are questions to be figured out, but Mallory, correct me if I'm wrong, but I think those are things that we're thinking through. But I think the commonality in both the set aside and this particular project is the better integration and coordination of dollars, trips, needs, and opportunities to do this work more efficiently and serve more people.
I agree with Jacob's point. I mean, as part of this, yes, we do need to figure out long-term with the hub, but since we right now only have the stage 1 funding, our priority is making stage 1 work and getting this pilot successful and off the ground. But those will be conversations we'll be having throughout stage 1 as well to prepare for that.
That makes a lot of sense. Thank you. Other questions or comments? Yes.
I'll just echo Frank's sentiment. I thank you. We're so excited that this is moving forward, and I think, you know, obviously the demand has grown and grown, but to see what the actual individual experience will feel like for an older adult is just going to be so valuable. It's so hard to send somebody down the rabbit hole of, you know, multiple cold calls to multiple agencies. Bringing this coordination together,
Thank you. I'm very glad that a little help is involved, so I'm excited.
Yes, and Jacob?
Yeah, I just want to clarify for the record, we've gotten a lot of help from a little help.
Great, thank you, Jacob. All right, any other comments or questions? All right, well, thank you very much, Mallory, for that presentation and all the great comments and compliments on this exciting process. With that, we're going to move on to our informational items, and I believe we just have one informational item today, which is item number 8. It was attachment F in your packet, and it is the exciting MetroVision Awards flyer, which I believe Ron is going to give us a quick update on.
Mr. Chair, just direct you to the last page in your packet. It's also obviously in the online version of the packet, so go look at that. We will have our annual award celebration coming up on August 27th this year. We're currently soliciting for nominations for various awards as part of that process. You all and your agencies do a tremendous amount of really work on behalf of this region, and you have good projects that are great examples of sort of our partnership and your contributions to our regional goals. So if you have any project ideas for MetroVision Awards, please think seriously about nominating those for our consideration and recognition at celebration. Always a great event. We have, I think last year we had close to 500 all over the region. So it's a really great opportunity to highlight your successes on behalf of the region. There's also individual awards that go out as well, so consider have any nominations. So encourage that. The submission deadline is Friday, April 18th.
Thank you, Ron. And I do have to say, moving the social hour to the lower floor was a much better idea last year, so that was great. And I think, to your point, incredible attendance and really a good opportunity to celebrate victories for all the region, right? And then seeing everybody get to celebrate each other's projects is really a unique opportunity that I always appreciate. Okay. Yes, Jacob.
Yep. One other announcement related to our packet and items. Cam Kennedy sent out this morning an addendum. As you recall, every time that we have a notice of funding opportunity that comes out, we ask you all to prepare grant information forms if you think that you're going to submit on a project. We do this for regional coordination and transparency. We did receive one this morning regarding the non-attainment area pollution mitigation enterprise community clean transportation assistance program. I think I got it right. From what I would characterize as the Colorado 119 Coalition regarding a potential NAPME, CC-TAP, I will now use the acronyms, potential project for that funding opportunity along the State Highway 119 BRT corridor. So we sent that out and just wanted to make you all aware of that. Thank you.
Thank you, Jacob, and thank you for announcing that one and not making me do it. I appreciate it. Ron.
All right, Mr. Chair, just one other thing. Won't spend a lot of time on it, but I know many of you or your jurisdictions have recently received discretionary grant awards through U.S. Department of Transportation. And if you had not executed a grant agreement with US DOT prior to January 20th, I think those have largely been on hold and not moving forward. On March 12th, we did become aware of at least an internal memo at US DOT laying out some process for them to review those unobligated discretionary grant awards. So we think that review goes back to grant awards since January 20th of 2021. I'm not sure how many that far back didn't have grant agreements executed. I suspect that most of the unexecuted grant agreements are for more recent awards. To the extent that we're aware of discretionary grant awards in the region to different agencies and jurisdictions, we'll get some more detailed information about this process out, just so everyone has it. I know probably many of you have seen varieties of it through different venues or different organizations. I just want to make sure everyone has the same information, anything that we can do to help do that process and help keep us informed that so we can engage with USDOT as well on your behalf and on behalf of the region. That's also appreciated.
Thank you, Ron. I think a lot of questions on that, so thank you. Okay, with that, are there any other member comments or other matters that were not covered on the agenda? All right, seeing none, our next meeting will be April 28th, 2025. And with that, we are now adjourned at 2:47 p.m. Thank you all.